we do have Dr. Ayman El-Hattab. He's the professor at the College of Medicine at the United Arab Emirates. Hi, Dr. El-Hattab. Good morning.
Yes, hello, hi.
Good morning. As the president of the MENA Organization for Rare Diseases, do you think that there are expectations and barriers to patient access to rare diseases in the region, especially given the vast differences in country income and health systems? It's a hard question because it's a number of components associated with it, and you're representing a number of countries with different economies. And I think it's interesting because of that representation of multiple countries that it might be useful for the audience to understand a little bit about your perspective on that.
Thanks, Stephen. Yes, indeed. Middle East and North Africa, MENA region expands over an area over like more than 15 million square kilometers with a population of more than 600 million people. And this region has a high level of genetic diseases because of large family size, a high maternal and paternal age, and of course, high consanguinity rates. We have a large number of barriers to access to orphan drugs or rare disease medications, and we can categorize these barriers into groups. The first one are the barriers related to healthcare systems. First, we have a limited number of physicians knowledgeable about rare conditions and limited number of specialized centers taking care of these conditions. We have big disparities between rural and urban settings with specialized centers mostly located in urban areas. Therefore, patients sometimes need to travel to access treatment. In addition, we have fragmented healthcare systems in many places, and this prevents healthcare providers from providing coordinated and effective management for patients. Finally, we don't have clinical guidelines for the treatment of most of rare diseases. Now, the second category related to regulations. The lack of legislation, regulations, and policies that facilitate patients' access to orphan drugs. And even when we have policies, main gaps remain price regulation and incentives that encourage market availability of these medications. Furthermore, the cost. We all know about the high cost of new therapies or orphan drugs. Insurance many times don't cover, and we don't have like a reimbursement for these medications, making considerable out-of-pocket expenses. And in many countries, the public health sector make prioritization for other areas like nutrition and communicable diseases. At the same time, we have limited non-government funding for rare diseases. Then we have barriers related to knowledge. We don't know much about the situation of rare diseases in most of our region. We have like lack of registries, epidemiological studies, cost of illness studies, lack of cost effectiveness studies to estimate the potential economic benefits of treating rare diseases. Now, if we have limited information, then our regulators and policymakers will not have like enough information to respond adequately to the needs. Finally, the advocacy. We have limited number of disease-specific foundations or support groups. And as we know, patient organizations play important roles in advocating for rare diseases. So these are the barriers that we need to overcome to make better access to orphan drugs for people who really need them. Thank you.
Thank you very much, Dr. El-Hattab. In terms of, I'm looking if there's any, we have a bit more, about a minute of time, and I was taking a look to see if there was any other questions that were being asked in the chat, but it looks like maybe not at the moment. So people probably will kind of think about what you presented and talked about, because I think it's an interesting component representing multiple countries. I think it is. It gives a different perspective.